Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question is maladaptive daydreaming a mental disorder? To help answer this question, I'll be using an article published in 2016 by Bigelson and colleagues, and I'll put the reference to this article in the description for this video. I actually had a number of questions around maladaptive daydreaming. Is maladaptive daydreaming a disorder, of course, but also is it the same thing as OCD? Is it the same thing as ADHD? And will it ever be classified as an official mental disorder, as a classification in the DSM? So I'm more or less compressing all those questions down to this one question about maladaptive daydreaming. So first, to define this construct. We know that maladaptive daydreaming is in fact a construct and not a mental disorder officially. It's when an individual routinely spends a large amount of time engaging in highly structured daydreams. These daydreams contain many distinct and well-developed characters, as well as elaborate plots. So it's really not simply excessive daydreaming, although excessive daydreaming would be a part of maladaptive daydreaming. So earlier I mentioned that an individual would spend a large amount of time engaging in this daydreaming activity. Prior research shows us that if somebody has maladaptive daydreaming, they spend about 56% of their waking hours engaging in the daydreams. Now, we also know that during the daydreaming, during this maladaptive daydreaming, there tends to be, for many at least, repetitive movement, like rocking or pacing. Prior research indicates that about 80% of individuals that have maladaptive daydreaming experience this repetitive movement. We also know that fantasy and reality are oftentimes not confused. Only about 2% of the time would individuals have difficulty separating reality from fantasy. So somebody's immersing themselves in a daydream, but they do understand it is in fact a daydream. They're not lost in the fantasy. We also see that there's this dichotomy between the daydreams being enjoyable but also disruptive, which really makes this construct seem like an addiction. Matter of fact, this addictive quality is oftentimes why people with maladaptive daydreaming initially seek treatment. So we see a difficulty controlling the need to fantasize. We see that these daydreams interfere with relationships or interfere at work or school. And we also see that individuals with maladaptive daydreaming work really hard to keep the daydreaming concealed due to embarrassment. So a lot of different aspects of addiction involved here, and this is another interesting question that we see around maladaptive daydreaming. So not just is it like OCD or ADHD, but also is it an addiction? Now we know, of course, that maladaptive daydreaming is not a mental disorder, and counselors oftentimes diagnose OCD or ADHD when they see somebody who has maladaptive daydreaming symptoms. Now this is of course because maladaptive daydreaming is not a classification in the DSM, and also there are no disorders in the DSM where highly structured daydreams would be a primary symptom. So I think in this instance, counselors are really just trying to do the best they can. They're trying to align the symptoms they're being presented with a diagnosis that exists in the DSM. We also see that daydreaming is extremely common in the general population. So counselors may be hesitant to conceptualize maladaptive daydreaming as a mental health problem. There's this real fear of pathologizing normal behavior, and sometimes for counselors, this is what this particular circumstance feels like. Taking somebody who experiences even highly structured daydreams with a lot of fantasy and making it into some sort of focus of mental health treatment seems like it could be incorrectly pathologizing the construct. Now, one key difference between regular daydreaming and maladaptive daydreaming may be the area of fantasy. Now here we're looking at fantasy as a fictional story created for no purpose outside of pleasure. And we know that fantasy occurs less frequently than daydreaming, but that's not the case with maladaptive daydreaming. As a matter of fact, maladaptive daydreaming could also be referred to as fanciful daydreaming. It contains a lot of fantasy compared again to normal daydreaming. So this particular study I'm referencing was really looking at the nature of maladaptive daydreaming, and they're trying to figure out if it really could be a separate disorder. They were looking at the relationship between maladaptive daydreaming, OCD, and ADHD, along with a number of other mental health constructs. So in order to accomplish these goals, they used 447 participants in the study. The age range was 13 to 78, and the average age was 30. And they took these participants and they divided them into two groups based on how they responded to a question about maladaptive or compulsive daydreaming. They define this construct as extensive compulsive daydreaming that can cause distress or impair functioning. So if an individual said yes, they had what seemed to be maladaptive or compulsive daydreams, they were categorized in the maladaptive daydreaming group. And if they said no, they were categorized in the non-maladaptive daydreaming group. So I'll just call this the MD group and the non-MD group here as I look at the results. So the results from the study were fairly interesting. They found that the MD group spent about 57% of their waking hours engaging in the daydreaming, just 1% different than we saw in prior research. The non-MD group spent about 16% of their waking hours in daydreaming. So this really just highlights how frequently daydreaming occurs, even when it's not considered to be maladaptive. We also see here that the MD group had daydreams that involved elaborate plots, fictional characters, specific fictional genres like science fiction, for example, and these daydreams had different time periods, so different genres and different time periods. With the non-MD group, the results were really much different in terms of the nature of the daydreams. The daydreams were much more reality-based and sometimes based on wish fulfillment. Now we see here that more than 80% of the participants in the MD group reported movement during the daydreams. So again, highly consistent with prior research. And we also see here that members of this MD group reported that the daydreams sometimes led them to laugh or cry. So there really seems to be an emotional investment component with maladaptive daydreaming that was not seen in the non-MD group. So it appears that the MD group had this ability to completely immerse themselves in a daydream world, and members of the non-MD group couldn't or didn't. So they couldn't do it or they didn't have this ability. Now we see that more than 50% of the MD group reported a strong urge to daydream immediately upon waking or immediately after being interrupted. So they would be daydreaming, they would be interrupted, and they'd want to return to that daydream right after the interruption was over. We see that both groups could control the daydreaming when necessary. So for example, if an individual was in public or in a social situation where it would be inappropriate to wander off in a daydream, both groups had the ability to control this behavior. Now, prior research had indicated that trauma may be etiological for maladaptive daydreaming, and this means that trauma could cause maladaptive daydreaming. This particular study did not find that to be the case. There wasn't really a link between trauma and maladaptive daydreaming. Also, prior research had explored the possibility that these fantasies are like hallucinations, and this was not the finding of this study either. So, no relationship with trauma and no relationship with hallucinations. We see that the MD group scored higher on all of the subscales of both the OCD and the ADHD instruments. So these are psychometric instruments designed to assess obsessive-compulsive disorder and attention deficit hyperactivity disorder. So this particular finding makes it look like maladaptive daydreaming is really related quite strongly to these two disorders. We also see that maladaptive daydreaming had a much stronger link to obsessions than it did to compulsions. Now, what's interesting in light of this finding about the OCD and ADHD scales is that the average score on all the scales were below the pathological threshold. So it seems that maladaptive daydreaming may be distinct, clinically speaking, but then again there is some overlap with OCD and ADHD. So this paper really ends with a lot of information being presented, but there's no definitive conclusion. It doesn't really tell us if maladaptive daydreaming is a distinct classification or should be a distinct classification, but it does shed more light on the potential relationship with OCD and ADHD. So it could be that maladaptive daydreaming is really a classifiable disorder that just hasn't been classified yet, or it could be a little known or little discussed symptom of another disorder that already exists. I believe there will be much more research on maladaptive daydreaming in the future, and hopefully it'll shed more light on its relationship to OCD, ADHD, and its potential standing as an independent disorder. I hope you found this description of maladaptive daydreaming and its relationship to mental disorders to be interesting. Thanks for watching.